Hello and welcome to Pregnancy Info. Today we are going to discuss the 20 causes of miscarriage. Having a miscarriage doesn't necessarily mean that you are infertile. Most women who have miscarriages have subsequent normal pregnancies and births. But what is a miscarriage? A miscarriage, also called a spontaneous abortion, it is the spontaneous ending of a pregnancy. A miscarriage is most likely to occur within the first 3 months of pregnancy. Before 20th week gestations, only 1% of miscarriages occur after 20-week gestation. These are termed late miscarriage. What causes miscarriages? About half of the miscarriages that occur in the first trimester are caused by chromosomal abnormalities, which might be hereditary or spontaneous in the father's sperm or the mother's egg. Chromosomes are tiny structures inside the cells of the body that carry many genes, the basic units of heredity. Genes determine all of the person's physical attributes such as sex, hair, eye color, and blood type. So, if there is a change in its number, then they will be above. Miscarriages are also caused by a variety of unknown and known factors such as infection. During pregnancy, some common infections like the common cold or a skin infection don't usually cause serious problems, but other infections can be dangerous to you, your baby, or both. Some infections may lead to preterm birth and low birth weight babies. Others can cause serious illness, birth defects, and lifelong disabilities such as hearing loss or learning problems. Some of the infections that can be dangerous during pregnancy include bacterial vaginosis, group B strep, hepatitis, sexually transmitted diseases, toxoplasmosis, urinary tract infection, yeast infection, Zika virus. Exposing to environmental and workplace hazards such as high levels of radiations or toxic agents can cause miscarriage. The hormonal and physiological changes that come with pregnancy are unique. Pregnant women experience sudden and dramatic increase in estrogen and progesterone. They also experience change in the amount and function of a number of other hormones. These changes don't just affect mood, they can also create the glow of pregnancy, significantly aid in the development of the fetus, alter the physical impact of the exercise and physical activity on the baby. If there is no number of proper hormones, then the baby will be abort. Improper implantation of fertilized egg in the uterine lining is another major cause of miscarriage. If it is occurred in tubes, then it will definitely abort due to lack of space or home for a baby. Maternal age. Studies shows that the risk of miscarriages is 12 to 15% for women in their 20s and rises to above 25% of women at age of 40. The increased incidence of chromosomal abnormalities contributes to the related risk of miscarriage. Uterine abnormalities. There are some types of uterine abnormalities that can cause miscarriage, like bicornuate uterus, unicornuate uterus, didactic uterus, T-shaped uterus, fibroid. Roughly 20 to 60% of reproductive age women have uterine fibroids. Some types of fibroids can cause miscarriage or other pregnancy complications. Fibroids usually develop during adulthood. Tipped uterus. Other than that, cervical insufficiency is another cause of miscarriage. Cervical insufficiency or an incompetent cervix means that a woman's cervix begins to dilate too early in pregnancy, resulting in preterm delivery and sometimes second trimester pregnancy loss. Cervical insufficiency is not a factor in first trimester miscarriage. It can be related to congenital malformations or may develop during adulthood. Lifestyle factors such as smoking, drinking alcohol, or using illegal drugs is another cause of miscarriage. Disorders of the immune system including lupus and autoimmune disease. Severe kidney disease. Women who have a kidney disorder that regularly requires hemodialysis are often at high risk of pregnancy complications including miscarriage, stillbirth, preterm birth, and preeclampsia. Congenital heart disease. pregnancy, even women with CHD, can cause birth defects, miscarriages, premature birth, low birth weight, and stillbirth. Taking good care of your own health is the best way to ensure the well-being of your baby. It's important to follow your doctor's orders and keep all of your prenatal appointments. Diabetes. Babies of mothers who have gestational diabetes have a high risk of developing obesity and type 2 diabetes later in life. Stillbirth, unrelated gestational diabetes can result in a baby's death either before or shortly after birth. Thyroid disease is the second most common endocrine disorder affecting women of reproductive age, and when untreated during pregnancy is associated with an increased risk of miscarriage, placental abruption, hypertensive disorders, and growth restrictions. Radiations. Most of the ways a pregnant woman may be exposed to radiation, such as a form of diagnostic medical exams or an occupational exposure within regularity limits, are not likely to cause health effects for a fetus. However, accidental or internal exposure above regularity limits may be cause for concern. Malnutrition increases the risk of poor pregnancy outcomes, including obstructed labor, premature or low birth weight babies, and postpartum hemorrhage. Severe anemia during pregnancy is linked to increased mortality at labor. Low birth weight is a significant contributor to infant mortality. Who carry group B streptococcus bacteria have healthy babies, but there is small risk that GBS can pass to the babies during childbirth. Sometimes GBS infection in newborn babies can cause serious complications that can be life-threatening, but this is not common. High levels of stress that continue for a long time may cause health problems like high blood pressure and heart disease. During pregnancy, stress can increase the chances of having a premature baby born before 37 weeks of pregnancy, or a low birth weight baby weighing less than 5 pounds and 8 ounces. Sex can be painful throughout pregnancy, not just in the first trimester. For the most part, it is because of totally normal changes happening in your body. Unless you have an infection, here are a few reasons why sex in the first trimester might hurt. Your vagina is dry because of hormonal changes. You feel like you need to pee or feel added pressure on your bladder. Your breast and nipples are sore. If sex is so painful that you are avoiding it, talk to your doctor. There may be an underlying medical cause, or the may be as simple as changing positions. Certain medicines, such as the acne drug isotretinoin, mean Accutane, is the cause of miscarriage. If you have already the history of miscarriages, and you have not planned the pregnancy over the gap, then it will also the major cause of miscarriage. Hope I have explained the maximum causes of miscarriages in detail. If you find the video useful, then like it, share it, and also subscribe my channel. Thank you.